Have you ever wondered what separates a good surgeon from a great one? It's not just about knowledge. It's about the finesse, the dexterity, the almost magical ability to perform complex maneuvers in incredibly tight spaces. Today, we're pulling back the curtain to reveal the secrets behind mastering complex manipulation techniques in surgery. This isn't just for surgeons, it's for anyone fascinated by the pinnacle of human skill. Are you ready to elevate your understanding and skills to the next level? Let's start with a foundational concept: surgical intuition. It's that gut feeling, that sixth sense a surgeon develops over thousands of hours. It's the ability to feel the tension in a suture, to anticipate how tissue will react before you even make the move. This isn't magic, it's deep-seated muscle memory and pattern recognition. To build this, there's no substitute for practice. Simulators, animal labs, and even simple drills like tying knots in a shoebox can train your hands to become extensions of your mind. Think of it like a musician practicing scales. It might seem repetitive, but it's the bedrock of every masterpiece. Now, let's get into the first of our 5 key techniques, the no-look knot. In minimally invasive surgery, you're often working with a limited camera view. You can't always see your hands or the instruments directly. The ability to tie a secure, reliable knot purely by feel is a game changer. This technique relies on proprioception, your body's awareness of its position in space. To master this, you practice tying knots with your eyes closed, focusing on the tactile feedback from the suture material. You learn the precise sequence of twists and pulls until it becomes second nature. It's a technique that saves precious time and can prevent catastrophic bleeds when visibility is compromised. Technique number 2 is tissue plane dissection. Imagine trying to separate 2 pieces of wet tissue paper without tearing either one. That's the level of delicacy we're talking about. Surgeons work within anatomical planes, which are potential spaces between different layers of tissue. Staying within these planes means less bleeding, faster healing, and better preservation of vital structures like nerves and blood vessels. The key here is using the right amount of tension and counter-tension. One instrument gently pulls the tissue taut, creating a visible or palpable plane, while the dissecting instrument, whether it's a scalpel or an energy device, advances along that path. It's a dance of controlled force, requiring a deep understanding of anatomy and a feather-like touch. Moving on to our third transformative technique, intracorporeal suturing. This is often called the Mount Everest of laparoscope surgery. Instead of tying knots outside the body and pushing them in, you're performing the entire suturing process inside the patient using long, rigid instruments. Imagine sewing a button on a shirt, but you have to do it through 2 tiny keyholes using a pair of 3-foot-long chopsticks. That's the challenge. Mastering this requires incredible hand-eye coordination, ambidexterity, and an intimate knowledge of how to manipulate a curved needle in a 3-dimensional space while looking at a 2-dimensional screen. The trick is to break it down into smaller, repeatable steps, loading the needle, driving it through the tissue at the right angle and depth, retrieving it, and then forming the knot. Each step is a skill in itself. Our 4th technique is advanced energy device application. Modern surgery isn't just about cutting and sewing. It's about using energy like ultrasonic vibrations or radiofrequency currents to simultaneously cut and coagulate tissue. This minimizes blood loss dramatically, but these tools are powerful and can cause collateral damage if used improperly. The secret is painting with the device, using short, controlled bursts of energy rather than holding it down. It's about understanding the thermal spread, the invisible zone of heat that extends beyond the tip of the instrument. Great surgeons know exactly how long to apply the energy and how close they can get to critical structures without causing injury. It's the difference between a clean, bloodless dissection and a complicated mess. Finally, technique number 5, the art of retraction. This might sound simple, but it's profoundly important. You can't operate on what you can't see. Retraction is the skill of gently holding organs and tissues out of the way to expose the surgical field. Poor retraction can obscure the view, or worse, injure the very organs you're trying to protect. The key is dynamic retraction. It's not about just pulling something back and holding it there. It's about constantly adjusting, using the least amount of force necessary, and repositioning your retractors as the surgical field changes. Sometimes, the best retractor is a strategically placed piece of gauze or even using the patient's own anatomy against itself. It's a strategic game of chess played in a confined space. So, how do you put this all together? It's about deliberate practice and seeking feedback. It's not enough to just do cases, you need to review your own surgical videos. What could you have done more efficiently? Where was your instrument placement awkward? Ask senior colleagues to critique your technique. This culture of continuous improvement is what defines the path to mastery. Remember, every expert was once a beginner. The journey is long, but every small improvement, every knot tied, every plane dissected, brings you one step closer to becoming a true artist in the operating room. What do you think is the most challenging aspect of learning these surgical skills? Let me know your thoughts in the comments below. Mastering these 5 techniques: the no-look knot, tissue plane dissection, intracorporeal suturing, advanced energy use, and the art of retraction is what transforms a surgeon's ability. It's a journey of 1,000 small steps, of relentless practice, and a deep, abiding respect for the human body. The goal is always the same: to achieve the best possible outcome for the patient with the least amount of trauma. Thank you so much for joining me on this deep dive into the world of advanced surgical manipulation. If you found this fascinating and want to learn more, make sure to hit that like button and subscribe for more content that unlocks the secrets of medical science. See you in the next video.